If you have seen a blister that looks like this on any way around your private part, you should know you are having herpes. Now, the concern of so many people is, can herpes be curable? Is herpes manageable? Can it be treated? And some people will ask questions like, how can herpes be treated? They want answers for all of these questions. Well, if you're that kind of person, you should know that this particular video is for you, and you need to make sure you watch this video to the end so you can get all the amazing information I have for you about this particular topic. And if you are seeing this for the first time, please do well to subscribe to my YouTube channel, because these are the kinds of videos I do every day. I talk about your health, how to stay healthy, how to manage your health, and you're going to be getting all the information you need to stay healthy. Now, let's start with what is herpes. Now, herpes is a viral disease that is caused by what we call herpes simplex virus. This virus gets into the body when you have an unprotected sexual affairs with an infected person, either oral sex, anal sex, or vaginal sex, which means you can get this virus when you have sex with a person that is infected with this virus, but it is highly preventable. It is an infection that can be preventable. And what are those ways you can prevent this particular infection? The first is using condom. Even though condoms does not give you 100% guarantee that you might not contact this virus, but using condom will prevent you to some extent of preventing this particular infection. The second way you can prevent this infection is, as a partner, when you are infected, you need to discuss this with your partner, because when you are infected, you're supposed to be taking some medications called antiviral medication, so your partner can also be taking those medications to reduce his chances of also getting this particular infection. Now, let's talk about the signs you might experience when you are having herpes. Now, a lot of people might be having herpes, but they might not even know, and they might not even know it's herpes. They might think it's just boil, rashes, and so many of that, but then it's not. It's herpes, and you need to treat it with the right medications you need to treat them with, because a lot of people say it do goes and come. After 2 weeks, 3 weeks, the blisters will come and it will go all of a sudden, and you'll be wondering if it's just normal thing. It's not a normal thing. That's how herpes looks like. Now, let's talk about the signs you're going to notice when you have herpes. The signs of herpes. Those signs you might see and confirm that, yes, I am having herpes, and you can start treating yourself, as I'm going to be explaining in the last part of the video. Now, one of the major signs you're going to experience if you're having herpes is blisters that go and come. After 1 week, they disappear and resurface back after 2 months, or after 1 month, after 3 weeks. And you'll be wondering if they are just normal boils, they're just normal blisters. They are not normal blisters. These are unique features of herpes. The second symptom you're going to experience if you're having herpes is pains around the pelvic region. As a man, you might experience pain where urine comes out. As a woman, you might also experience lower abdominal pain, some kind of sharp pains within your pelvic region. It's mostly due to herpes. If you're also having herpes, you might experience fever, headache, body pain. These are all symptoms of herpes, and they are treatable, which means you can treat them. Just that a lot of people have mistakes when treating this kind of infection. So a lot of people do mistakes of using antibacterial medication when treating herpes. How can antibacterial medication be used to treat an infection that was caused by virus? When treating this kind of infection, the best thing to do is to use antiviral medications like acyclovir tablets. You can use acyclovir cream. These are creams that can reduce the viral load and also give you a chance of healing up fast when the blisters are present in your body. And it can also reduce your chances of having recurring symptoms, having subsequent outbreak. Now, as a person, one of the things you must also do when treating herpes is using anti-pain ointment like lidocaine that will reduce the pain around the site of blister, because once you are having this particular outbreak of blisters, you will experience so much pain that might be unbearable for you, and the only way you can reduce this is by using anti-pain ointment like lidocaine. Now, you might also need to use medication that will fast track healing after the blisters are present on your genital area, and one of them is vitamin C. Vitamin C is always important in terms of healing of the particular wound you are having around that region, because there will always be wound, and it might also help in boosting your immunity. That's the major thing you need when you are having herpes, to prevent the virus from resurfacing back after you might have treated it. Now, the question that a lot of people will now be asking is this virus curable? Can you cure this virus once and for all? When you are having herpes, can you just eradicate it out of your system completely without it coming back again? The answer is no, because it's a viral disease. When you take these medications, the viral load might reduce from your system, but then this virus will go to some specific place in your body and just hide there until you are having triggers like low immunity, you are sick, or you are having some kind of fever. That's when these blisters might resurface back. So the best thing to do when you are having herpes is not to panic, because when you panic, that's when your immunity might be low. And this virus does not come with complications like that when you are taking your medications. Now, one of the ways you can prevent complication is make sure you are taking your medication. If your partner is not having this infection, make sure you communicate it with your partner that you're already having this infection, so your partner can start taking medications to reduce his chances of contracting this infection. Now, when you are having outbreak of this particular blisters, avoid sexual intercourse, because when you have sex within this period, this is when you have high chance of transmitting this virus to your partner. Now, you might also need to make sure you are eating good diet, because good diet helps your immunity to be boosted. But once your immunity is very low, that's when you might be having recurring features of this particular infection. So after watching this video, if you find it very helpful, please do well to subscribe to my YouTube channel. Don't forget to also drop your questions in the comment section, and I'll be right there to respond to them in due time. Thank you for watching this video. I'll see you next time.